Can neuroplasticity help stroke patients with aphasia? Imagine your brain as a flexible, ever-changing network that can adapt and grow even after injury. That's what neuroplasticity is all about. When someone has a stroke that damages parts of the brain responsible for language, neuroplasticity can help the brain reorganize itself to regain communication skills. This process is especially important for people with aphasia, a condition that affects about 30 to 40% of stroke survivors. Aphasia can make it hard to speak, understand speech, read, or write, depending on where and how severe the brain damage is. Recovery from aphasia relies heavily on neuroplasticity. The brain can form new connections to bypass damaged areas, which is why rehabilitation is so vital. Speech and language therapy is the main approach used to harness this ability. These therapies involve structured exercises that target specific language skills, such as pronunciation, word meaning, sentence structure, and overall communication. By repeatedly practicing these skills, the brain is encouraged to rewire itself, strengthening existing pathways or creating new ones. In recent years, scientists have also explored non-invasive brain stimulation techniques like transcranial magnetic stimulation and transcranial direct current stimulation. These methods can gently stimulate the brain to increase activity in areas involved in language. When combined with speech therapy, they may boost the brain's ability to reorganize and improve language functions more quickly. However, these techniques are still being studied, and their use should always be guided by healthcare professionals. It's important to remember that recovery from aphasia varies widely from person to person. Some individuals may regain most of their language abilities, especially if therapy begins early and is intensive. Others may experience more limited improvement, particularly if the stroke caused extensive damage or if therapy is delayed. Rehabilitation also includes teaching patients and their families strategies to communicate effectively despite ongoing challenges, which can help improve quality of life. Overall, the current medical consensus is that neuroplasticity is a key factor in recovering from aphasia after a stroke. The brain's ability to adapt and reorganize itself provides hope for many patients. The combination of speech therapy and, in some cases, neuromodulation techniques can support this natural process. But it's crucial to remember that each person's recovery journey is unique. Factors like the severity of the stroke, how soon therapy begins, and the intensity of treatment all influence outcomes. Always consult healthcare professionals for personalized advice and treatment plans.